Why is achieving lupus treatment goals emotionally hard? Living with lupus is like trying to hit a moving target. The disease is complex and unpredictable, making it tough to set and reach treatment goals. Because lupus symptoms can come and go, and often mimic other conditions, managing it requires constant adjustment and patience. Diagnosing lupus is not straightforward. There is no single test that confirms it. Doctors relying on a combination of symptoms, physical exams, and lab tests. Common signs include fatigue, joint pain, skin rashes, mouth sores, unexplained fever, and sensitivity to sunlight. These symptoms can appear and disappear over time, which adds to the challenge of tracking the disease. To diagnose lupus, doctors look at the whole picture. They examine the patient's medical history and perform physical assessments. Laboratory tests are crucial, but they are not definitive on their own. The anti-nuclear antibody test is positive in nearly all lupus cases, but many healthy people can also test positive. So, doctors check for specific autoantibodies like anti-double-stranded DNA and anti-Smith, which support the diagnosis. Blood counts are also measured because anemia and low white blood cells are common in lupus. Inflammation markers like erythrocyte sedimentation rate can indicate inflammation but are not specific to lupus. Kidney and liver function tests, along with urinalysis, help identify organ involvement. Sometimes, skin or kidney biopsies are performed to confirm damage. Because symptoms overlap with other diseases and can fluctuate, doctors often requiring at least for characteristic signs or symptoms to diagnose lupus. This process involves ruling out other causes and interpreting test results carefully. It's important to understand that lupus diagnosis is a process, not a one-time event. Ongoing evaluation is often needed to confirm the diagnosis and adjust treatment plans. Achieving treatment goals is emotionally difficult because lupus is so variable. Flare-ups can happen unexpectedly, and symptoms may not always respond to medications as hoped. Patients may feel frustrated or overwhelmed by the unpredictability. The goal of treatment is to control symptoms, prevent organ damage, and improve quality of life, but this requires a personalized approach. It involves balancing medications to manage inflammation and immune activity while minimizing side effects. Patients often face the emotional toll of living with a chronic illness that can affect their daily lives, mental health, and relationships. The uncertainty about how the disease will behave makes it hard to plan for the future. Support from healthcare providers, mental health professionals, and loved ones is essential. It's also important to remember that each person's experience with lupus is unique, and treatment plans should be tailored to individual needs. In summary, the emotional difficulty of reaching lupus treatment goals stems from the disease's complexity, fluctuating symptoms, and the ongoing effort required to manage it effectively. Always consult healthcare professionals for personalized advice and support. Managing lupus is a journey, and with proper care, many people can lead fulfilling lives despite the challenges.